Hi guys. I'm Callie, your big sister MD, and today I'm joined by.
Hi, my name's Amelia, also known as Amelia Med on TikTok and on Instagram.
Good, yeah, let people know where they can find you. Kind of what is your social media account about, and when did you start social media?
So I actually, it's a bit of a long story. My social media started as a
Oh,
fitness page way before med school. It was all about kind of fitness and wellness. And then as I was preparing to apply for med school, and then as I got into it, it became a lot more about medicine and my journey as a medical student. And I initially started on Instagram, but kind of over the past year, I've migrated over to TikTok, and I feel like that's kind of where I'm most comfortable. Is just a little bit less polished and a little bit less filtered, and
mm,
yeah, I just enjoy it a lot more. So the handle is at Melia.med with Melia.med with two L's. So yeah, that's where you can find me.
great. I'll put her Instagram and TikTok in the comments, and also tag her so that you guys can go ahead and follow her. So Amelia, tell us a little bit about yourself. Where are you from? Where do you study? Where do you plan to practice? All those things.
9 years old, and so I've spent most of my life here. I'm kind of in the process of deciding where I'm going to practice. I think at the moment is looking that I'll very likely I'll be staying in the UK, but where it is kind of, because I'm a final year, we're in the middle of all of that process, so it depends kind of how the offers come in and how things are. And where I get placed, basically. A lot of it is quite random the way it works here.
You're going to practice in the UK for sure.
I'm like, so for now, yes. I'm not ruling out a cheeky 2-year gap year to Australia.
Love it. Love that for you.
Yeah. But I think, I mean, I really like practicing within the NHS or within like a system that is similar to the NHS. And so that's kind of, I guess, would be one of my major reasons for staying. And also I want to stay within Europe so I can be close to my family. I wouldn't really see myself super far away for a long period of time, but maybe for a little bit.
Okay, cool. And can you talk to us about what inspired you to pursue a career in medicine, and how that inspiration has evolved throughout your journey in medicine?
Yeah, sure. That's it. I think I really like this question. So, honestly, it was a bit of a basic response. I wanted to do medicine because I really liked science when I was in school, and then I also wanted a career that kind of serves people, and by that also like serves God. And this has evolved massively since I've actually been a medical student and since I've kind of progressed throughout medical school. My kind of love for science has really transformed into a love of research. And so now it's not just about kind of learning the pathophysiology or learning the anatomy. It's seeing how I can take that and then apply it. So I really see myself doing academic medicine in the future, which is really nice. And that's something that inspires me and keeps me going. And then kind of things that have happened in my personal life. So with my family, certain like illnesses, deaths, personal problems also have really helped me to put kind of, as you just grow up, like I guess life into perspective. And then it has really dawned on me how much of a privilege this career is. I kind of would always get told like, oh, being a doctor is such a privilege, like such an amazing career. But honestly, I just kind of wanted to do something sciencey and I just thought it was cool, like when I was 15. And it's only now that I'm really understanding the impact that you can have on people, the trust that people have in you. And I just feel like it's such a blessing to be able to do that and to have that impact on others. And I'm so affirmed that that is what I want to do for the rest of my life.
Do you want to talk a little bit about your research? Like, what research have you been able to do in uni, or what research do you plan on doing? Kind of like what areas, stuff like that.
Yeah, sure. So I have always had an interest, so yeah, since I was like 15 in cancer care and oncology. And it's, I guess, because I just thought, oh, they don't really teach us this in school, but it's such like a big thing for people's lives. Like 1 in 3 or almost 1 in 2 now people will experience cancer at some point throughout their lives. And it's something that I didn't get taught about in school. So kind of taking that and running with it as I got to medical school is always the research that I've been on the lookout for. I have been involved with a couple of projects. Every kind of project that comes my way, every opportunity of research that comes my way, I try to make it stem towards kind of cancer care. So initially, kind of the very first thing I did was in my third year GP block. we did a quality improvement project, and luckily actually the practice gave us a project on bowel cancer and anemia, so looking at whether people over the age of 60 with new onset anemia were being referred for bowel cancer investigations, basically, to rule it out. So that was kind of like the first dip into it in medical school. And then since then, I've been really lucky to get involved with 2 systematic reviews on pancreatic cancer and the management of pain and cachexia. So it's really linked to palliative care as well, which is an area of interest of mine as well. And then most recently on my GP block that I've had now in 5th year, I've started looking at the kind of appropriate stopping of breast cancer drugs in primary care, such as like tamoxifen and things like that, and whether they are being stopped at the correct time. So it kind of started from being a quality improvement project, but I'm now trying to kind of collect more data and see if whether this can be made into like a cross-sectional study. So a variety of things, but I've always kind of kept that oncology vibe going. And even my undergrad dissertation, my BSc dissertation, was on repurposing drugs in cancer. And I remember thinking I need to make sure my undergrad dissertation is on something cancer related. So yeah.
Oncology. Do you want to go into oncology specialty?
Yeah, I think currently the way things are, that is probably top of my list. Just because I just feel like if I've had an interest in it for so long, it's just going to carry on and get stronger. And especially seeing it's such a nice specialty in the sense that research evolves very quickly. You get to see really improved patient outcomes year on year, and throughout your career, you can really see that. You can really see making a difference on a huge level, even if on like a microscopic level with the patient. Sometimes, obviously, sadly, you can't. And I think I very much would like to be like a holistic oncologist who, you know, doesn't just push like chemo, radio, these kind of things, but really looks at like what matters to the patient and what kind of what their key concerns are. And so that's why I'm like, I still really do enjoy palliative care, and I'd like to be an oncologist who take kind of the palliative care principles with them when that's needed, to kind of make sure that the patients aren't just, it's not just about the drugs, it's not just about survival, basically, is what I'm trying to say, is the whole outcome of the patient. It's how they feel about things, it's how they live out those last years, months, or weeks of their lives. And I feel like if I do oncology, I'll be able to both have that kind of palliative care insight, and then I'll also be able to do really fun and exciting research and hopefully see really good survival outcomes for my patients as well.
What advice would you give to pre-medical students considering a career in medicine?
Oh, I like this question as well. So my biggest thing that I always say to kind of pre-meds when they ask me is research, 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 research as much as you can about the profession. I'm not from a medical family at all. I will be the first doctor in my family, God willing. And I had no idea what I was getting myself into. I'll be real honest with you. There are still things you discover going along the way of what the profession is actually like, what the work culture is like, what the pay is like, all these kind of things that you just learn along the way. And I was lucky enough that I had one doctor who was my best friend's mum. Shout out to Jeanette, who got me like my first work experience, and I could ask her about things. But if you're in a position, if you're coming from a medic family, if you're in a position where you know doctors, you know other healthcare professionals, I don't know, PAs or nurses, ask them about what it is that you're going into, especially if you're like UK based. Ask about the NHS. What does it actually involve? How do you practice? What are the challenges? How long the career path is? You have like, when you're 18, 19, you have no idea that it might take you years to like become this surgeon that you want to become. Because people go into med school and they're like, I want to be a cardiothoracic surgeon, like pediatric one or something. And it's like, babe, that's going to take you 20 years. I hope you're ready for the ride. So my biggest piece of advice is just research as much about the career as possible. And also, if you are able to financially, don't rush into it. So the way it works in the UK is you can go straight from school. So you can, at 18, start training in medical school, graduate when you're 23 and be a doctor really young. Med school isn't going anywhere. The only caveat with that is for us in the UK, is that if you do a degree before, you kind of get the government student loans for that degree, and then for your second degree you don't. So that's the position I'm in. So I had my, oh my god, I love your dog. Sorry. I did my first degree. I kind of got the loans to pay the tuition fees for that, and now sadly I didn't have the loan to be able to pay for my medical school fees, so my parents had to pay that. Not everybody is in that financial situation, and you know, it is a lot of money. So if you're able to financially, take a longer time to get into it, because I think I actually prefer the system they have in like US and Canada, where I don't think in Canada, definitely in the US, where you have to do it undergrad and then you go into med school, because actually that age gap between 18 and 21 is huge. And you gain so much maturity and so much insight into your life. So if you can afford to kind of take a gap year and really think about, is this something that you want to do for the rest of your life? Because it's yes, you can do other careers outside of medicine. Of course, you can finish med school and then, you know, go into finance or insurance or tech. And I know med students that are going to be doing that. But it is ultimately a career for the rest of your life. So my advice is don't rush the decision, and take time researching what the career is like. And also, if your heart is set on it, like, believe in yourself, because if you believe that this is your place, like, you're halfway there.
Oh, that's great advice. Yeah, I think it's really important to know that this is like literally a never-ending career. Like, it's not just medical school.
Yeah.
It's medical school and then residency, and then after residency, and then you do research, and then you can become a professor, and then you can do this, and then you can do, and it's like,
Yeah, for sure.
So can you talk a little bit about, like, I understand that in the UK there's different pathways to medical school and different like durations of medical school. So how long is medical school for you? And you know, what are kind of like the other options for any student that's looking into going into medical school in the UK?
Yeah, sure. We have lots of different pathways. So for me, it is 5 years. So I'll kind of explain my journey and then hopefully stem from that. So I did a 3 years undergrad degree, because I didn't get into medical school straight from school. So when I applied after my A-levels, after sixth form, I at 18 basically I didn't get in, so I said I'll do a degree and then reapply after my degree, so that at least I have something if I change my mind, or if I can't get in again, you know, I have a BSc, I can go on to do something else. So after you finish, if you're taking the road of going straight from school, you've just got the option of a 5-year degree or a 6-year degree. Now, 5-year degree is like the most standard one, just years 1 to 5, and you need the high grades of like 3 A's or something. I don't know what it is now because it might have changed, to get in. If there are certain universities which are incredible, and Leicester's one of them, shout out, which offers something called a foundation year. So that is like a year 0. That is for students who either didn't meet the grades, come from a widening participation background, where they come from a school where they were unlikely to meet the grades that are required. So like from a more disadvantaged area and things like that. Or they did A-levels in subjects that are not medicine related. So for example, they don't have chemistry, they don't have biology, they did like art and history, and then they decided, oh, I actually do want to do medicine. So they can have a year 0 where they kind of get caught up in all of that. And then they go into the normal 5-year program. So Leicester is one of the basically like the pioneers in the whole foundation school kind of business, and their first foundation year doctors just graduated last year from Leicester. So I think it's a really great system, because it really widens the participation to medicine, really opens it to a lot more people, you know, with different life paths, different perspectives. So that's kind of if you're going straight from school, those are the 2 options. If you've gone my route, so like do a degree and then go into med school, you have the 2 options. So you can enter the standard 5-year course, which is what I did, which is where you don't get funding from the government. You just kind of have to pay for the fees yourself. Or you can enter a 4-year course, which is like an accelerated course. And basically what that happens is the first 2 preclinical years are like scrunched into 1 year. So it's a lot more intense. Like people who are on GEM medicine or graduate entry medicine, is what it's called. They do say it's a lot more intense, but you do get some funding from the NHS actually to do that course. It's a lot more competitive. So I applied. You have a maximum of four med schools you can apply to in each cycle in the UK. So I applied to 3 for a 5-year course and 1 for a 4-year course, because I knew the chances of me getting to a 4-year course were a lot lower than onto a 5-year course. Onto a 5-year course as a grad, you kind of have the advantage of the life experience, the maturity and things like that. You come across an interview a lot better than somebody who's 17, for the most part, obviously. So I kind of just played my cards, and I was fortunate enough that I could go for the 5-year course. So yeah, so there's like 4, 5 and 6, and it depends which way you want to swivel into it.
So you've done now a total of 8 years of schooling, like, yeah. Wow.
It's been a long journey.
It's not for the faint of heart, that's for sure.
Yeah. I didn't take a gap year before my uni or before med school. Like, I just straight ran through. Like, I have friends who, same as me, did an undergrad course and then perhaps a master's. I even have friends who did PhDs and then went into med school. But like, everybody has seemed to take a little gap somewhere along the way, and I just haven't. I just powered through.
Yeah, I tried to do that, and life really hit me over the head with a rock and was like, you know what, you need to take a gap year. So
yeah,
I feel you on that one for sure.
some...
Building off of that, what advice do you have for fellow medical students? And especially, like, if you could make a little caveat in like resources that you have for medical students, that would be lovely, because resources are super important.
Yes, for sure. So, resources wise, it's so dependent on, like, the specifics are so dependent on your med school and on where you're practicing. So I'm sure that, you know, you will be learning things that, yeah, overall the overarching themes will be the same as mine, but they'll be different. The best thing I learned is something called active recall. Have you heard of that before?
Oh yeah, love it. Amazing.
So in my first year of med school, they sat us down and they were like, right, you lot that are just copying the slides and making notes, stop it right now. And I was one of those people, and I just felt so attacked, like, oh, what the heck do I do now? What do I learn? What do you mean I can't make my pretty notes? What do you mean about just write it all out? So they said, no, none of that. And the technique that I got taught that I actually loved the most is something called a brain dump. So you go to your lecture, you don't take notes, or at most you just annotate the slides, right? You just listen and you absorb it, and you're present in that lecture, which for me is like, it was so hard. I used to really struggle. But the whole point is that you're present and you're not focusing on doing anything else. And then a couple of hours after the lecture in the afternoon or the next day, you sit down, you write the topic of the lecture in a bubble on a piece of paper, and then you write from the lecture everything you can remember. So you can do it obviously like in sections and then branch off, and it creates like a mind map. You sit there exhausting your brain. You set yourself a timer of maximum like 20 minutes, 15 minutes of everything you can remember about that lecture. And it can just be key words, key phrases. And then what you do, once you've kind of exhausted your brain, you literally can't think of any more. And trust me, sometimes it would be like I had 2 words on the page and I was like, I actually don't remember anything else. You go to the slides, and then you fill in what you missed in a different color. And so that way your brain, retrieving the information, which is that active recall, helps you, and then having the contrast of now the new things being added and linked in visually with the things you already had, it kind of helps to make the neuronal connections in your brain. So that's a really good technique that I like, and if I'm learning new content, it is something that I still sometimes do. As I kind of progress to clinical years, it is the standard of flashcards and questions for me. And I'm affiliated with, and I absolutely love, QuesMed, which is, I appreciate, like a UK based kind of resource. I mean, I don't see why it would harm anybody else outside of the UK. I think it's brilliant. But they have pre-made flashcards, and they have question banks which are specific to the UK finals, which now they've also expanded to like postgraduate exams, which is incredible. And they also have the preclinical kind of resources. So my kind of thing now is I do a little bit of questions a day, and it's literally 20 a day. It's not 200. It's 1,000 Anki flashcards. And then I do about like I think my goal on the app is like 100 flashcards. And I think keeping on top of it bit by bit is probably the most effective thing. You will just naturally study more when the exam time comes around, because the adrenaline starts to kick in, and you know you've got that push and everybody around you is studying. But actually, for the most part during the year, let yourself enjoy placement, let yourself enjoy learning from your environment, because I think a lot of the time we go on placement and we're so stressed, like, oh, I have to be here, I can't be studying, or, you know, I'd rather just be in the library, I'd rather just be at home in bed or whatever, that you don't actually take the learning opportunities that are there. And I think if we make good use of placement, we'll be able to just absorb so much more knowledge without having to do the sit down study, you know what I mean, like the kind of sit down studying. So I think it's, yeah, I think like yourself, like enjoy placement and then just do a little bit every day. That would be my biggest tip.
And you mentioned Anki. Do you use Anki?
So I kind of do, kind of don't. I'm not like a I'm not an Anki queen. My housemate, she's an absolute Anki queen, and her decks, like, I would pay millions for. Like, if anybody wants Anki decks, like her Anki decks are like sensational. But I do sometimes. So if there's a concept I really can't remember, and I've gone over it on my QuesMed flashcards, and I've gone over it on the questions and I still don't get it, then I will put it on my Anki and I will make basically decks for things that I really can't remember. But funnily enough, I do use Anki, not the blue Anki app. I just feel like the interface is a lot nicer. I tried the blue Anki app, so you hated it. And I did use it for like interview prep, so I was learning some definitions for an interview I had, so I used it for that. And even for like my driving test, I used it for that. I think just the active recall method is really good. Yeah,
That's great. And how do you get started? Like, as somebody, like, obviously on TikTok, it's all over the place about Anki and like how to set up your Anki deck and how many Anki cards I'm doing and blah blah blah. But how do you get started with Anki? Like, I have heard about it. I'm way too scared to try it. It just feels super overwhelming. Feels like there's like it's so technical with all the settings and all the information you have to put in and stuff. Like, where do you think is a good place to start?
so I think that's because everybody's using the app with the blue star, and everybody is like using the app. That's just not that useful for me. The one I use is called Anki app, and it's orange. And basically you either download it like on your laptop or on your phone, and it is just so simple. It's basically, you can create different folders of a topic. So like say I don't know, I'm on urology right now, so I can create a deck for urology, and you can start making your cards, new card, and you can have like a question, I don't know, for example, like what is the most common type of kidney stone, and then you write the answer and you just carry on making them. Where you get the information from, I think, is a lot more of a question rather than how you actually do the Anki. Just don't use the blue app because it is so complicated. And then you can set on the app what your goal is for the day of how many you should do. And then you can set whether you want a reminder or not. Like I don't, because I just feel harassed by the apps. Like Duolingo is enough for me.
Yeah, completely.
So like I can't have another app harassing me. I'm like, I will do this on my own time. I know I have to do it, just leave me alone. And I just think it's setting like really unrealistic expectations. Like I don't know. I always see US medical students and I think, how the hell are you doing 1,000 Ankis a day? I can't relate. I don't know. Like, are your exams this hard? Is there just so much more competition? Are you expected to, like, I don't know. Like, I wish I could like see what they do over there. Like, I wish I could almost go there for a semester and see, like, is it actually that hard? Or is it just this pressure of what everybody else is doing around you? Because I feel like in the UK, med students have such like a lot more of a chill approach to medicine than like in other parts of the world. And I think it is the way that it is taught it's so clinically focused from day one. Like, I don't think they teach us BS. Like, I don't need to, like, realistically, to be a doctor, do you need to know the Krebs cycle? Probably not. So they don't teach us the Krebs. They teach us things like you need to know for like for your job quite early on. I remember even learning like about like proteins and blood structure and, you know, all that kind of biochemistry stuff in year one, and it was always focused around all right, well, you need to know this because if you have a patient with thalassemia, then their structure looks different, their structure of hemoglobin looks different. So it was always with that in mind. And yeah, so I like how it's taught here, so I don't feel the pressure of doing 1,000 Ankis a day.
Well, speaking of that, how is it? So you have like 2 preclinical years where you're not in the hospital, and then the last 3 are completely in the hospital, or do you do like half and half? Do they wean you off? How does it work?
So dependent on your med school, so like traditional ones like Oxford, Cambridge, and some of the London ones, they will do 3 years. So they will do 3 years preclinical and 3 years clinical, but it is dependent basically on your med school. At Leicester, what we do is 2 years preclinical. So first year you are basically in lectures all the time. Second year, basically in lectures all the time. And by all the time, I mean, in first year, you have the morning in lectures and then afternoon either for cadaver lab or self-study, basically. And then in second year, it's flipped. So you're in the afternoon and then have the morning for either like cadaver lab or self-study or kind of other things. And then in third year, you start clinical placement. So then you're in the hospital basically all the time. So you'll have like, you go into whatever ward you need to be on or whatever clinic, and you get your schedule. And alongside that, you'll also have bedside teaching. You will also have sometimes tutorials, sometimes lectures. So like when I was just on GP block, we had 2 tutorials a week. So it was like a morning and an afternoon that I wouldn't go into GP. I would just have like an online lecture about something, or like they were more like reflections by the time you get to 5th year, because there's not really new content. In 5th year, what you do is called an assistantship. So you're basically learning the job of a junior doctor. So now I'm on ward on my surgery rotation on urology, I just follow the F1. I do everything he does. So if he needs to make a phone call to microbiology and do a referral, I'm doing the phone call. If he needs to take some blood, I'm taking the blood. If he needs to present a patient, I'm presenting the patient. If he needs to prep the notes, I'm prepping the notes. So 5th year is very much like they are prepping you to do the job, but it's not every med school that has that. Because I've met F1s from other med schools who are like, don't really know what I'm doing. Like as in actually how to do the job, but I really like our system that we do it that way. You do also have a little bit of time in hospital in first and in second year. So you, in your first few weeks of med school, you have something called like VECI, or at least we had, which is very early clinical exposure. So you go for like a week in a GP practice or a week in a hospital shadowing somebody, just to kind of remind you why you're there. You know, it wasn't just a science degree.
Yeah, that would have been nice. We didn't have that at all in Spain. It's not like that at all. It's very much like you're either in the classroom or you're in the hospital. It's like not, it's very mutually exclusive. So that sounds like a great kind of like crossover situation.
Is it 6 years in Spain?
It's 6 years in Spain, yeah.
So like 3 and 3. Or when do you get clinical exposure?
So the first 2 years are purely in the classroom, and they have like in our university, there's a different campus. So you're like off of the hospital base, you're completely on a different, location. And then third year, you have maybe 2 or 3 weeks rotating through the hospital. And all of the courses are now clinical, like it's like pathological immunology and ophthalmology and family medicine and stuff like that. But not all of them have clinical rotations. And if they do, some of them are only a couple of days. So it's a very, very limited exposure to clinical rotation. And that's part of the reason why I got burnt out, because I was feeling so like gypped. Like where are the patients? Where is the exposure? Where is the clinical time? You know, like that was the stuff that I was looking for. So it's good to hear that in the UK, it's a completely different system that's more oriented with patient care.
It's very clinically orientated from day one, and I know when I compare to how it is in Poland, it's very much what you're describing. Like in Spain, I think they probably get even less clinical exposure. I think it's literally like in the last 2 years, and it's a 6-year course, and you just don't get a lot of time. And like when I go into a surgery, I'm easily the only med student there. In Poland, there'll be like 10 other med students with you, because they're just like, it's just, they don't have the resources, they don't have the they're unable to have that clinical exposure. And I just think, I don't know if I could do this degree if it was so book heavy. I think I would really struggle, honestly. So the fact that it is the way it is, I feel like has really allowed me to like do my best and thrive and stuff, because I learn the best practically. I think a lot of people do, and I think at the end of the day, if you're going to be a doctor, you're going to be doing the practical stuff like most of the time.
Like you said, the birth cycle is just a non-issue.
Yeah, and the thing is, you're going to learn all this preclinical stuff, you're going to forget it within a year.
Exactly.
It's not going to stick in your brain. If you asked me now, like, to name a certain tendon that I learned in first year, I could not tell you. Like, and because 9 times out of 10 it's so irrelevant to my practice, and if it is relevant, actually the name I can look up. You know, like
I have my anatomy book, I have my netter, like, you know, guide, I have all the stuff.
Yeah.
How have you managed the workload and the stress load of medical school, speaking of that? Because I mean, since it's not as book heavy, it sounds like maybe there's a little bit, I mean, I'm not going to say there's less stress load, because I'm like a stress, because that's just not true. If you're in medicine, it's stressful. There's a huge workload. There's a bunch of stuff you have to learn. So how have you managed that? Tell us.
Okay. So the first thing like to say is, I guess this is working on it and managing stress and managing your workload and trying to strive for a good balance. And it's obviously everything I talk about on my page is kind of, it's about taking time out for yourself. It's about having a good balance of your work and your life outside of medicine. But it's an ongoing process. It's something I'm still learning. Like, I still have weeks where I feel burnt out. I still have weeks where I feel like, oh, maybe I've gone out a bit too much, or I've, you know, not done enough studying. And it is just, it's like a seesaw, and it just constantly goes up and down. And, you know, mastering that, I feel like, is really like a lifelong process. I think the thing that I really focus on is having like doing my best to plan in advance, basically. So it's not always possible with medicine. Sometimes you get your rota last minute, sometimes, you know, life happens. But ultimately, if I plan things in advance and I put literally everything on my calendar, and sometimes it is as trivial as like I don't know, like film a TikTok or like take out the bins. If everything is in one place for me, that's kind of how I manage everything, both medicine and like life related. And something, I don't know if you know the YouTuber Ali Abdal, he does like tips for, yeah. So something I remember watching of his was that he would schedule in his social time first. And that feels really scary at first when you say that to a medical student. You're like, what do you mean? But like, I have to do my 1,000 Anki today. But actually, you schedule in your social events and time for yourself. So I do this. So if I know I'm going to be going out with my friends on a certain day, if I know actually after a whole week I need an evening to myself, I'm scheduling that in, and that is like protected time. And if that is scheduled in, then you will actually find you have a lot of time in the day to still be doing other stuff. The key is to kind of not be doing BS things. So like, for example, I try to only watch Netflix when I'm eating, so that it's not like something that on its own takes up time, unless I'm in my me time, and then I get to do whatever I want, and whether that's watch Netflix or eat cookies. So doing it kind of that way, so that when I'm not doing something that's productive to me or something that is enjoyable to me, then I can be doing my work. And it does sound scary at first, but it's served me and it's worked for me all these years. And, you know, thank God so far I've not had to reset any exams. Hopefully that stays that way. So it does work. And I actually, a lot of my friends, I think, have a similar approach. Obviously, when you get closer towards exam time, that changes, because you can still kind of prioritize your social stuff first, but if your friends are medics, nobody's going to be doing social stuff. So no, but then that time to make sure you have time for yourself really kind of pops up, and actually you need to be a little bit more aware of scheduling that time for yourself, and then studying does take priority over things. As for kind of when I do actually get stressed, and I feel like I get really overwhelmed, I'm somebody that really like turns to my faith in those times, and tries to really focus on why I want to become a doctor, and just trying to have like a perspective on life that, like I always say to people, whether it's med students or pre-meds or whoever, medicine can be one of the loves of your life. Absolutely. It is a huge one of the loves of my life, but it's not my whole life. It will never be my whole life. And so sometimes when the stress like floods you and you're just like, oh my God, I'm close to tears, like I can't do this. You need to just take that step back. And it's very good, hopefully, having that you have people around you who remind you of that. And whether they're medics or they're non-medics, or it's your friends, family, I don't care who it is, but you need someone around you to say, all right, we need to just take a step back. Just look at the bigger picture in life, you know, let's be grateful for some things. Let's, you know, journal down what we're grateful for. Let's see, you know, how far we've come so far, and things like this. So yeah, I think that's kind of how I deal with it.
I think that's a great advice. Like that's a great way to deal with it. Like I personally forget all the time why I started medicine. And it really does, it's so easy to forget. And it's so important to stop and be like, okay, this isn't about just like acing the next exam or getting through the next semester, or, you know, just graduating. Like I feel like the goalpost is always moving. And so it's so important to stop and be like, no, I'm grateful to be here right now. If I like, my past self would be dying to be where I am right now.
Facts. No, facts. Because I always think about this, and funnily enough, it's TikTok that always helps me reflect, because there'll always be a trend of something being like, oh, past me. But I do think about it, and I'm like, if 15-year-old me knew what I was doing right now, like she's screaming and jumping up and down, and like she's so happy and so excited. And sometimes I just think, I'll just do it for her, you know, like just have that reflection. And equally, like future you is going to be so proud of what you're doing right now and how you're looking after yourself. And if you know, if you do burn out, or if something kind of happens now that means then you can't carry on with it, like you're doing kind of an injustice to your future self as well, like if you're not looking after yourself properly. Do you know what I mean?
Yeah, totally.
Like at some point we have to pay the price if we don't look after ourselves. Either you get sick, and I do this happens to me all the time. If I get too burnt out, I just get ill, and my body's like, hold up, no, time for bed. So yeah, I think it is really important, and to see how far we've come, and yeah, it's just keeping that reflective mindset.
Totally. So to kind of build off of that, do you think that you have a work-life balance? And if you do, how do you achieve that?
Like I kind of said to you before, it's always a moving scale. Like it's never, I don't think it's ever fully straight. And I used to think that there was a perfect way of keeping it straight. And actually, as I've gone through med school and as I've kept like doing my page and things like that, I've realized it isn't about having a perfect balance. It's about having a balance that is like good enough. And I think so often we want to just, as medical students, strive for perfection and having a perfect balance and being perfectly healthy and being, you know, being perfectly on top of your work. And it's like, it's okay just to have a balance that is good enough. And I think I do that by kind of what I've already mentioned to you, like scheduling things in properly when I need to, and making sure, like, putting me first so that I don't burn out. And it is something that I still struggle with. I think like just everybody does, because when you're especially in a profession that wants to, like, you want to serve people, right? You want to do the best, you want to be the best, like you want to push forward constantly with what you're doing. You need to remember you can't be constantly pushing forward. Like it's impossible. Like, you're a human being, you're not superhuman. So keeping kind of that perspective of, I can't always keep going. Sometimes I need to just stay where I'm at, or even take a step back. That's okay. And I think that kind of approach helps me. And on a practical level, put everything in my silly little calendar, my Outlook calendar, just helps me. And then I can see, okay, what am I doing today? And it's like an hour by hour breakdown. But also not being too strict with that, because I've made that mistake before.
Yeah, I do the same thing. If it's not in my calendar, it doesn't exist to me. Like, I
No,
will
but
forget immediately. Yeah. Stuff like that, to a pass-fail system, which I think is so interesting. If you could talk a little bit about how that's impacted you and like the medical culture of like medical school, because I feel like it's so competitive of like, well, what did you get? Well, you know, like, where are you in your class? Like, oh, you know, like there's not enough spots, there's not, you know. So how has that affected you personally and the medical culture around you?
sure. So we're the first year for this to be introduced. So there's been a lot of debate. Basically, long story short, it used to be the following system. So you sit your exams throughout medical school, and all your exams would, at the end of all your exams, so in Leicester, that's one at the end of every year. In other med schools, it may be different. You would be ranked from top to bottom, and you would get something called a decile, which is effectively the percentage in the year group that you're in. So first decile would be top 10%, second decile would be top 20%, and so on and so forth. And all of that would get accumulated. So from year 1 to year 4 would get accumulated. And then you would be given at the end of year 4, at the start of year 5, when you're applying for your foundation training jobs, something called your EPM score. And that score would basically have been a reflection of your average decile over the last 4 years. So that was half of your overall score. The other half was a situational judgment test. Now, sounds all fair and good, like it's like a common sense test. However, people said over the years that it is impossible to revise for. The answers like sometimes don't match, or it's like the same question. The answers, like in a very similar question, wouldn't be the same. And effectively, it was eventually admitted, or I guess people figured out, that this test is a lot more of just a randomizer. So you would have the results of the situational judgment test and the results of your EPM score combined to give you a total score. If your total, it was out of 100. So say your total score is like, I don't know, 100. You would then have first pick of where you go in the country for your foundation years. Okay. So if you're 100, you rank London, which is the most competitive. As first, you're guaranteed to get London. And then it kind of got filled in that way. If your score is 0, then you don't get first. I likely wouldn't get your first choice if it was London. But if it was a place that was really unsubscribed, for example, I don't know, like, where's really, like, this region of the country, for example, with the competition ratio would always be below 1. So people would say, oh, you're always guaranteed to get Leicester because there's not that many people want to go there. So even if you score really badly and all of this stuff, you'd still end up in the region. It wasn't always the case. But yeah, so that's basically how it was. That score was not reflective of your final kind of degree score. So what you get at the end of your degree, whether you get a degree with honours or without honours, is solely based on your finals. So if you're in the top 10% on your finals test at the end of 5th year, you get honours, and that has stayed. That's still there. But nobody really looks at that. That doesn't really have an impact on your life. I mean, yeah, you can flex, you know, in the future that I got honours at medical school, but like realistically, it doesn't have such a direct impact as your scores would have along the last 4 years. So now this has been scrapped, and what happens is that score out of 100 is completely random. So you get assigned a random number. and it's not out of 100, is whatever number, however many applicants there are, everybody gets assigned a random number. The idea behind it was that it was supposed to make things a bit fairer, equalize good doctors going to areas which needed them, and not having that kind of thing of every good doctor is now, you know, every smart medical student is now in London, and, you know, widening that gap between, I don't know if you've heard of like the inverse care law. It's like that the people who are in the poorest areas are less likely to have access to good healthcare, and people in the richest areas are most likely to have access to good healthcare. So it's about equalizing that. There were also issues with kind of things like ethnic minority students are less likely to score higher on exams, whether that is bias or social barriers or things like that. So it's about equalizing that, and various different things. Now, people feel like now we don't have control of where we go because the number you're given is random. I always had the assumption that I always felt like it was a bit random, because that second part, that SJT, whether you get a high score on it or not, that to me was always random, because it's not a test you can revise for, and it's not a test that I think shows how smart you are. Realistically, on the SJT, very few people fail it. If you fail it, then you're not a competent doctor, because you don't know the basic difference between like punching a patient in the face and like giving them some help. Like the questions were a bit ridiculous. So it's like, well, you shouldn't be practicing anyway at that point. So that's what it's gone from. And now, yes, you do get pass. It is like kind of now pass or fail. You do still get given, well, I still got given last year my decile for my year 4 exams. So you still do the whole thing of, what did you get? What did you get? If you want to be involved in that. I think, I don't know whether it depends on your friendship group or just who you're with or your level of maturity. I'm like, all my close friends, I'm probably like, I get probably like the lowest decile out of my close friends, but they're all like stupidly smart. But it doesn't really, we don't really do the whole comparison thing, to the point where like, I maybe know the deciles of like 3 of my close friends. Nobody further past that. Nobody really cares that much, especially now that they didn't matter. And I think going forward, it will really change the culture. Obviously, I think I'm like too early to know yet how that's changed, you know, the years lower down, and whether they will be given deciles. Because we were for our 4th year, but I don't know if anybody else was like in the lower years, or if they will be in the future. But I think it will make it a lot less toxic, which I'm a huge fan of. I do think it will equalize things. And I do also think that, controversially, how good of a doctor you are is not always reflected in your exams. And I also think that scoring well in your exams can also be a huge privilege, because there are plenty of medical students who are carers, who are parents, who are unwell themselves, which affects their performance in exams. Does that mean that in 10 years, they're going to be a worse practitioner than somebody else? I don't think so. And so I think basing where you go in the country solely off your exam performance, I mean, I don't know, I don't think it was fair in of itself. So I'm a fan of the changes. I've always been a loud fan of the changes, but not everybody is. It's been a bit of a controversial one, especially because it was introduced quite quickly. As they always do these things, they don't care about you know, anything. Like, it used to be that actually your score, that score out of 100 that existed, used to take into account your previous degrees. So I would have got an extra score for my BSc, for example, and then like 1 year they just scrapped it like that within like 2 months. And people had like made the decision to intercalate, to get like a master's or a BSc, and they said, oh, actually no, it's not counting. So yeah, these decisions are not really made with students in mind a lot of the time. I don't know who they keep in mind, but it ain't us. And yeah, that's how it is.
So the way that you're, okay, so just to be clear, what does pass fail mean then? Does that mean that your exams, like, you don't get a score, it's just pass or fail? Or does that mean that only at the end it's pass fail? Like, what does that mean exactly?
So it depends on your medical school, how you're assessed. So I still got a score, and you will get a score, and it will tell you whether it's pass or fail. I think basically the change now means is that the score that you get doesn't influence where you will be for your first 2 years of your job, whilst before it did.
Gotcha.
That's kind of the bottom line. Yeah.
And how many exams do you have per year? Like, do you only have one exam that then ranks you in your? You have one exam a year. You don't have
not like one paper. So we have one set of exams. So it used to be in your preclinical years you had 2. Again, this is a Leicester thing. So I know in other med schools they have lots of smaller exams, for example, or sometimes they have it at different times. So whoever you speak to, they might have a different experience if they're in another med school. But we have an end of year exam each year. And that includes a SBA paper, so single best answer, which is different to an MCQ, by the way, because it's all these answers could be correct, but like which one is the best one? So it's like, what is the best initial treatment? And they will list you all the treatments that are for a certain condition, but which is the best? Like, which is the initial one? The best initial one, you know what I mean? So it's a little bit different to just like an MCQ, because you're never going to have something rogue in there. You're never going to have like, I don't know, like say it's like a surgery question. They will all be surgical techniques. You're not going to have something random. And then single, like a single answer question. So you'll have to type. So there'll be like list 3 risk factors for something. But it's always like, apart from, and then the 2 most obvious thing, give 3 risk factors for this, or 3 side effects for this, which is really, really annoying. And then you have OSCEs as well. So you have 2 days of OSCEs, like 6 stations and then 6 stations.
Okay, great. And so do you have semesters? Like, do you have an exam after your semester, or just like, really?
No, just the whole, you have blocks. So like in your clinical year, you'll have like in 3rd year, it's 12 weeks medicine, 12 weeks GP, 12 weeks surgery. And then you have like a formative exam, you have like a test that doesn't count for anything at the end of it, just to see whether you kind of, like, you know, whether you're on the right track. But you don't have like actual, they don't count for anything, no.
Wow, that is very, very different from all of the other systems that I've heard. So I'm really excited to hear about that. That sounds like a great option. So if you don't want to do a lot of, you know, exams, maybe check out Leicester. Sounds like a great system.
Sure. Yeah. Yeah. And we don't have essays or anything like that either. Like if you're not an essay, then come.
You touched on some study strategies that you have, such as the brain dumping and doing kind of like mind maps and Anki and all that kind of stuff. Do you have any other study strategies or techniques that have worked really well for you, or something that you've learned kind of new this year that you want to talk about?
I'm trying to think. Is there anything new that I've learned this year? I think the biggest thing I learned from my other exam, so from my last exams, is that you know, I told you we have a single best answer paper and a short answer question paper. The difference between my SBA mark and my SAQ mark was like 10%. Like it was stuck. And I was like, so clearly I had been doing enough of those SBA questions on Quizmet. Clearly that's pulled through. But I hadn't been doing enough of short answer questions, and I would always get to kind of exam season when I would start doing them. So there's like a book that we have, which is just like SAQ book, and I think it's literally written by like a Leicester grad years ago, so some of it is outdated, but the structure of the questions is very similar to what we have in our exams. And so I guess my biggest thing is kind of doing them earlier this year. So starting the SAQs earlier, and I think weaving in the flashcards in a little bit earlier for me as well, because again, I would kind of just be like doing them a bit late. And also working with my housemates and with my friends a lot earlier. So not just getting to exam season and being like, okay guys, we're going to revise now, which is what we always do, and then we have like really intense sessions together. But and I've been doing this with my clinical partners actually when I was on Outlook, which worked quite well, is doing stuff basically together a lot earlier. So studying with your mates, with your friends, with your housemates, whoever, I think is such a great benefit, because they will point out your flaws that you might not know you have. And they will be able to, you will just learn so much more from them, rather than you know, just sitting and staring at a book yourself, or sitting and staring at your laptop. And you'll be able to gauge a perspective of how much time studying is the correct amount, and they'll be able to keep you in check of, okay, we're too tired now, maybe we should take a break. Whilst if you're studying just by yourself, it doesn't, you just don't have that. Like, you just don't have anybody to kind of come in and be like, okay, it's break time now.
Yeah. Validate the need for some rest.
Yeah, for sure.
I can tell that you're very motivated and very passionate about medicine. How do you stay that way with all of the challenges that comes with studying medicine and, you know, exam season and all of that kind of stuff? How do you stay so passionate and motivated?
Oh, that's so kind. Thank you. So I kind of, as I already said, like, I keep my why at heart. That's kind of advice I'd give to anybody. And if your why is strong enough, if it is rooted in you and who you are as a person and the difference that you want to make in this world, whatever that may be, I think it is what will keep you through. Because if you're doing medicine just to have a good paycheck at the end of it, really and truly, especially in the UK, it's not enough to get you through.
Yeah.
If you're doing it to please your parents, it's not enough to get you through, because you will have these moments where you're just like, I'm burnt out as shit. I'm hating everything. And doing it for other people is not enough. For me, my faith really grounds me on why I'm doing it, and ultimately I'm doing it to serve people and serve God. And in my darkest moments, when everything goes, like everything goes, that's what keeps me going. And then also because I have the thing of my parents had to kind of pay for my degree, like for this one, whilst obviously a lot of my peers, like, they get funding from the government and things, and so on, so, you know, the funding works differently and stuff. And so because my parents had to pay for this degree, I also kind of have this thing of, I cannot let them down. And whether that's the healthiest mindset to have, I don't know. I guess to finish the degree, that will get me through. But I always knew that there has to be more after that, because once I've done the degree, it's like, okay, I haven't let my parents down, but now I need to sustain this motivation for the rest of my life. And when you have patients that touch your heart, and when you have moments where you really feel like you've done a good job, like you've actually just made a difference, is then reflecting on those moments when you're in a state of absolute crap, that will keep you going.
In what ways do you think being a medical student has changed you as a person?
Oh my God, you know, when you sent me this question, yeah, I loved it. I loved it. I was literally like, oh, this is such an interesting thing for me to reflect on. So I think the most major thing that medicine has taught me is gratitude. I used to be, as most teenagers are, quite an annoying little shit. And I don't think I was that grateful for things. And I think sometimes I was such a brat. And I would sometimes have, as some of us do, like a victim mentality of like, why me? Why did this happen to me? And things like that. And the way this career will force you to be grateful for absolutely everything in your life. Obviously, starting from your health, starting from just being alive. But just like the little things, I think I savor the small moments now so much more. Like, so much more. The fact that I'm able to have a cup of tea, the fact that I wake up every morning, I just reflect on that a lot more. It's made me a lot more of a reflective person as well. And I'm just like, it's taught me just to say, like, you know, thank God for everything, like a lot of the time throughout my day, and just being grateful, yeah, for absolutely everything. And I think it's made me a better listener, a better friend, a better daughter. I think the way I interact with people now I'm just like, I'm a nicer person. I'm literally a nicer friend and a nicer family member to have, because I think I'm just able to listen a lot more, because it's obviously something I have to really practice with my patients. But it's a skill that actually is, I think, can be quite hard to apply to those that are closest to you, like the ones that are closest to us, we always just take them for granted. And I think it's actually taught me to be a better human being.
Oh, I love that answer. That's so good. And to jump back into specialties and your future, are there any particular areas of medicine or medical specialties that you find especially fascinating or compelling? Especially if there's anything other than, I mean, obviously oncology for you is like the big one. Is there any other, specialty that calls your name, or like maybe tell us a little bit more about why oncology is so important to you?
Yeah, so interestingly enough, there are a couple more that I feel like they're creeping on the sides. I do really like primary care, so I do really like family medicine, GP, these things. But actually I've got a video on this coming soon, but I just think the system of the NHS and how it isn't something that I can work in all honesty, the way it is right now. Maybe if I practice somewhere else, I'd be more likely to be like a family physician, but I'm also not a generalist, in all honesty. I like being honed in on one thing. With that in mind, the thing I think I liked the most about after oncology was probably pediatrics.
Ooh.
I loved working with kids. I honestly loved it. And I did have a little bit of a thought one day of doing pediatric oncology. I think that would literally be my dream, but you have to do the peds training and then do onc training on top of it. So you have to like start off as a pediatrician, which means you have to learn all of the peds stuff. And because I'm not a generalist, I know I struggle with it. I know I struggle to learn like surgical stuff for pediatrics and like dermatology and orthopedics for pediatrics, like things I just don't really enjoy that much. I think I struggle with the exams, in all honesty, and it's a grueling pathway. The peds regs, like registrars, like the training doctors that I saw, they're always so tired. They're just always so tired, and they're running around and they're making life or death decisions. And it's like, I think obviously pediatrics and obs and gynae as well, which is another one I really like. They're such emotive specialties. So what I really struggled with on pediatrics is all the safeguarding issues, or children who, for example, have been left in hospital by parents and not picked up, children who have parents who are drug abusers, unfortunately. And that really, peds and obs and gynae were the two specialties where I would come home, go to bed, and as I'm closing my eyes to go to sleep, I see the ward. Like I'm seeing it, and I know other specialty gives me that. Oncology doesn't give me that. Like oncology just gives me kind of peace. But these two, I think because they were so emotive, they really like evoked a lot of emotion in me, I guess, and made me think, oh, maybe I could do this. And it's not like I'm afraid of it, there's such hard situations, and I don't think I have that barrier of being scared to be in them. But I do have the consciousness of this is a lot to take on for the rest of my life. If I find it emotionally hard now, how will I find it, when I have 3 kids and 2 dogs and a mortgage to pay? Like, how will that take a toll on me in 10, 15 years? Obs and gynae I loved as well. I love working with women. I love helping women. I'm like, yes, girl power all the way. And I think again, the safeguarding things were difficult, and it's just sad that you have to do surgery to go with it. I'm just not surgically inclined at all. Like, it's just not me. So the fact that like maybe a C-section is like as far as surgery I would go, but you still have to learn everything else. For gynae, the only kind of way around that is if you do what's it called, like gum training. So basically like genitourinary medicine training, like community kind of STIs and things like that. But just for that by itself, I don't have enough of an interest in it to go into it. And yeah, the reason I love oncology is because the research is so evolving, and you get such a holistic side to the patient. You literally get to help people at one of the most vulnerable times of their whole lives. and you see a range of patients as well, different ages, different tumor sites. Like, it's all medicine related, but you get to, and it is so heavy on the medicine, which I like it's so like internal med heavy, which I feel like where my strength is and things like that. And you just, it's just like a little bit of holistic medicine, a little bit of like radiology as well, like if you want to do the radiology side of things. Yeah, it just has a bit of everything for me. The research is exciting, the patients are in like, it's a very unique time of life for them that I think I can just like appreciate and like learn from, and I like being in that environment. And there's such a close link to palliative care, which means most of the time patients get treated very well. I think in oncology it's also like where the money is, so the research, the patient care is good, so you have fewer of those situations of like, oh, like this shouldn't happen like this kind of thing. And yeah, and it is something that's obviously so universal, affects people all across the world, is only going to get kind of more as we, you know, live longer. Yeah, I think that's it. I think those are my oncology reasons.
Okay, I love hearing you talk about it, because as somebody who's never even thought, like, I would never even blink at oncology, honestly. Like, I had absolutely zero interest in it. As somebody who wants to stay as far away from like mortality rates in patients as possible, I'm really like, wow, that is true. Like, yeah, like, yeah, that makes a lot of sense. I love that perspective. Like, you're really convincing me. I'm getting excited about doing my oncology rotation now.
Yeah, honestly, it is so special. It's just it's a really special specialty. It just has such a place in my heart, and I think because I love like working with women and helping women, I think like most likely I would probably do like gynae or breast, like medical oncology. So yeah, I kind of wanted to combine the two. So now when I'm doing research, I'm trying to tailor it to that side of things. So yeah.
Love that for you.
No, I'm just saying, I always tell people oncology, and then like, especially if they're like non-medical, they look at me like,
Yeah.
what the fuck, you want to do that?
I'm thinking, like, really, oncology? Like, where all of your patients are like doomed, you know what I mean? Like, but then when you're talking about holistic care, palliative care, taking care of them, end of life care, stuff like that, I'm like, wow, she really gets it, you know? Like, you're not going in with this idea of like, oh, I'm gonna cure cancer and I'm gonna save everybody. Like, this idea that like you can really, like, my grandma, I was super close with her. She was like another mom to me, and she died of a glioblastoma, which like absolutely destroyed her in 9 months. And it's so true that like you can really give people like a good death. You can give people like a good end of life experience that doesn't have to be so traumatic for the whole family, for the patient, for everybody. Like, you can really make such a big difference in not only the patient's life, but the family's life as well, by bettering their care. Like, as somebody who went through a super traumatic cancer death, like, I totally see that for you, and I love that you have that perspective, because it's just like you're gonna be the best oncologist. Like, you really, really are.
That's so sweet.
Yeah.
Oh, that's so sweet. Thank you. Yeah, I think people miss that. I think people think like, oh, oncology is just doom and gloom, and like your patient's going to be dying, and all you're doing is prescribing palliative chemo. But you forget that it's actually at those points that sometimes you make the most difference, you know. And I 100% I get that it's not for everybody, and I think the beauty of medicine is that whatever kind of person you are, there'll be something for you.
Yeah.
And I used to think that there's such a one size fits all when it comes to doctors, and it's just not. Like, so many different personalities can do like so much, and whether, you know, you're like throwing hammers around, you can be an awful bro, or whether you want to, you know, send people after their death, you can be a palliative care doctor. Like, there's something for everyone. I think it's beautiful.
Yeah, I completely agree. Cool. Before we end the interview, I do want to ask you about conferences, because I'm making a bunch of videos about conferences, and I'm also going to my first two conferences this year. So I'm super excited. So have you ever gone to a medical conference?
Yes. So
Yes.
I've been to two. So I've been to two and put on one. So I've actually put on a conference as well. So I'll start with the one I put on. So, which was an online conference that I did with NAMUS, which is the North and Midlands Oncology undergraduate students, which is like basically a society that was created by a student at Keele University, and it encompasses lots of students from different medical schools who are interested in oncology. And we did like an online oncology conference, had a really good turnout. We had speakers from all across the world because the theme was oncology in a global context. So I kind of was involved in putting that conference on and doing the social media for them, etc. So that was great. That was like a student-led conference. And then I presented a poster at the MREM Network conference, which is the Midlands Racial Equality Network, I think. Basically, they talk about racial equality in medicine. And it's a nationwide thing, and it's now sponsored by a lot of med schools and a lot of big companies. So it's like it started off being as a student-led thing, but now it's being very much incorporated into lots of curriculums and things. So it was a bit more a step up, I guess, from just a bog standard like student-led conference. So I presented a poster there, which was basically about my experience with my SSC, which was at the Hope Clinical Trial Centre here in Leicester, and it's about kind of access to clinical trials and the barriers that ethnic minority patients face when accessing cancer clinical trials, which is really interesting. The conference was really great. I had lots of speakers talking about racial equality in medicine and decolonizing the curriculum and things like that. And then I went to a proper big boy conference this September. So I presented a poster there, which is basically the kind of the protocol for the systematic reviews that I'm working on with a team of kind of doctors and professors and other students from UCL. That's the one on pancreatic cancer and pain and management of pain and cachexia. And basically I was presenting about how we're hopefully going to take the results and then feed them into surveys and focus groups, and just adding that qualitative element into it and getting patient views on the results of our systematic review to see how feasible they are. And so I went to that was a great experience. It was a surgical conference, and as I told you, I'm really not surgically inclined, so I kind of went in there like, well, I'm kind of just here to present and then I'll dip. But surprisingly, I had a great time. Not enough to make me want to be a GI surgeon, because it was like the Association of the Upper Gastrointestinal Surgeons, but I did have a great time, and I feel like I learned a lot. And I was really worried that I would go in and not know what they were talking about in these talks and in these things, but actually I found the language really accessible. I found that they presented their results in a way that I was really able to understand. At least 90% of them, I guess some of them did go over my head, or if I like zoned in on out, like you had to really concentrate on what they were saying, because if not, then you kind of lose the plot. And it was so fun to like play on the little robots that they had, little surgical robots. And I spoke to other junior doctors, other med students that were there. It was a lovely experience. It was in Oxford, and there were people from all over the world there. And so it was a 3-day conference. I just went for the 1 day to present, just because I think like you have to pay. And then also I didn't want to take any more time off, because it's not like I'm surgically inclined, so I was just kind of there to do my job. But the rest of the day was lovely. So I highly recommend going to it. And I do recommend medical students going to a conference, because the tickets will always be cheaper for a medical student than when you graduate. So if you can, go to them. And my med school allows us time off to go to conferences, especially if it's to present. And actually, they also reimburse you the money that you spent if you write a report on your conference. So my med school did that for me. So I wrote a report about what I learned, etc., etc. And they reimburse like all my fuel money, all my lunch money, like all of this stuff. And my ticket for the conference, brilliant.
Wow. And are you planning on going into like an oncology conference, for example?
I don't have any like at the moment. My dream one day is to go to one of like the bigger like oh my god, what's it called? It's literally escaped my brain. Basically, there's a big like European Oncology Society, and they put on the conferences all around the world all the time. So I'd love to go to one of those, but they are so expensive. Like we're talking like £200 plus for a ticket, plus travel, plus all of these things. Realistically, it's not a student budget type of situation for me. So yes, but I don't have any plans at the moment.
Well, I hope to see you at a conference one day. I mean, like,
yeah,
I found out about how awesome they are, and like I'm going to too, so I'm super excited.
Yeah. Oh, that is fun. I hope you have lots of fun. They are really great, and they're such a great opportunity to like network and learn something new, and like, yeah, it just opens you to new topics that you might have not thought about before, and gives you good ideas for like your own kind of research and things like that. And it just solidifies all the kind of things you learn in medical school about you know, like stuff like p-value and like study designs and like social sciences, and it's like we all find that so boring, I think, but going to a conference like puts it in perspective, so it makes it practical, so then it's easier to remember.
Yeah, that is true. I mean, God, p-values and statistics. So. Okay, so we have arrived at our final question. So, Amelia, if you could go back and give advice to your younger self when starting medical school, what would you say?
I would say enjoy the ride. I just say enjoy every minute of it, because it's going to fly by. Like, I don't have any regrets about how I lived my med school years. And that was, I remember coming into a first year, and my kind of mindset was, I just want to make the most of this. And that is both in studying, but also when it comes to social life, societies, making friends, like diving into then clinical kind of experience. And my advice would be like, don't hold back, like just enjoy the ride and don't hold back, in like every sense of the whole student experience. And do a little bit every day. Don't leave it all to the last minute. So when you've got exams, just prep ahead. Do a little bit every day. Don't get too carried away. And I just don't regret it. Like in first year, we would like have parties till like 4 a.m. and then go into a 9 a.m. lecture, and I don't regret a single minute. Yeah. It was normal, and we did that 3 times a week. Okay, maybe not till 4 a.m. 3 times a week, but we would go out 3 times a week. The first semester of first year in the UK, like, by the way, this is just a side point, your first year is like the chillest. I don't know, like in Europe, like in Poland, for example, your first year is the hardest, and then people drop out after first year. In the UK, your first year is the chillest, and your first semester you have freshers, and you literally get to med school and the lecturers are like, right, you're a fresher, you need to enjoy yourself. And there's kind of that understanding that everybody's just going to be wild for 1 semester, and then we're going to like buckle down and get things sorted. So I remember like we had like an initial introduction to like basic life support, and there's a pub crawl that we do. It's called PJ pub crawl. So all the freshers go in pajamas, and then the other years are dressed as like something funky. So you usually do like group outfits, like I don't know, I did Shrek with my housemates last year. And then basically, I don't know if you want this, you know, if you want to crop it or not, but basically like what happens then is like all the other year groups end up like feeding the freshers like alcohol, and it's just all a bit wild, and like we go around different pubs and then end up at a club. Anyway, so I had my PJ pub crawl in freshers when I was a fresher, and then we had like basic life support training the next day, because this pub crawl is always on a Tuesday, because it's something called Freshers Week. So you arrive and then you have like a week of parties basically, and like social events. So now like a lot more people don't drink, so there's a lot more non-drinking events, but like back in my day it was crazy. So you have like a week of parties, and that's known, that's like a well-known fact. The faculty and everybody knows, like Lusuma, the society, is what organizes it, like they organize the Freshers Week. And we turn up to basic life support training, and everybody's just dead, and the facilitators were like, right, okay, so the toilet is there, if anybody needs the toilet, I don't need to know, I know it was PJ pub crawl last night, just leave and go if you need it, and just come back. Like the fact that it was like everybody knew. I remember sitting there laughing, like probably hungover myself at that point. But yeah, it was just crazy. And so I don't regret any of that. It was fun, and it just does, as you progress, it does just get more serious. Like obviously I don't go out 3 times a week now, barely go out. Like I don't drink anymore, but if I do go out, it'll be like once a week. And yeah, just make the most of it. Honestly. It's gonna fly by. It really like has flown by for me, and I'm thinking about it now that I've got the last few months left, and I'm like, oh, I'm gonna have to be an adult now, not just a 25-year-old teenage girl.
So you guys, I hope that was helpful. If you guys have any questions, please, you can find Amelia at Med.
Yeah.
Med on TikTok and Instagram. And do you have anything that you want to say, Amelia?
I just want to say thank you so much for having me on here, giving me the space to talk about all the things I'm so passionate about, and about medicine, and you know, work-life balance, and just staying afloat as a medical student. I really appreciate it, and it's been great to chat to you and get to know you, and, you know, compare and contrast our different journeys. I think it's been really lovely. So yeah, thank you.
Oh, thank you, Amelia. I could talk to you forever.